This child's age is 4 years old. I believe she turned 4 a couple of months ago. And she has a diagnosis of spastic diplegia. She has increased tone in her legs, which is the reason why she has difficulty with walking. I've worked with this child for the past 2 years. So I started with her when she was just 2. She'd had therapy in another setting before that. And when I began with her, she wasn't crawling, she wasn't certainly getting up on knees, was sitting but not real stable in sitting and very uncomfortable with any tipping her off balance. So she's made a lot of progress since then to be at the point where she's starting to take independent steps. The primary gait deviations with her are that she has excessive pronation when she stands without her DAFOs, and that she has some plantar flexion. She also has a lot of tone overall in her legs. It's difficult for her to get nice knee flexion because she tends to fix into more of an extension position. Probably she doesn't take a step on her own barefoot because she's just too unstable. With her DAFOs, she's definitely getting to the point where she's becoming an independent walker. Without her walker, she's much more unstable. She takes short steps, quick steps, kind of goes from one object to another quickly so that she can be there and hang on again. And when I slow her down, I need to give her a little support. And at this point, I can really hold her at her feet and give her enough support for some independent walking. She is currently wearing a number 4 DAFO, which is the kind of DAFO that she's always worn. I believe the benefits of this DAFO are that it gives her flexibility in her ankle in plantar flexion, dorsiflexion, whereas if we went to a higher DAFO, a number 3, for example, she would be blocked in plantar flexion. And because she still crawls, and for other activities where you need to have plantar flexion, it's nice that she has that freedom. I think it gives her enough control without needing to go to a number 3. With the DAFOs on, we can improve her foot position and get her out of all of that pronation, and we can also help control her going up on her toes and get more of a flat-footed and even somewhat of a heel-toe gait. We do a lot of work on half kneel to stand at different surfaces, at different pieces of furniture, and the dollhouse is a nice one because she enjoys playing at the dollhouse. And we often will put the toys down so that she has to come down to get them, and then she comes back up to put them in the dollhouse. Grandma says, "Put me in the house. Hello, I want to go in the house. Come get me." And I work a lot on coming up to stand from half kneel over either leg. We work a little harder on the right leg because she's stronger on the left leg. And I really work on facilitating a normal movement pattern in coming from half kneel to stand. This is an activity that she does because she's at risk for having tightness at her ankles with too much plantar flexion just because of the muscle tone that she has in her legs. We start out with both legs just to stretch out both ankles into dorsiflexion. It's just a nice way to get kids to do some standing stretch with dorsiflexion. And then we go to the right leg because that's the one that is more at risk for being tight than the left leg. So this again is another stretch activity. She is also at risk for having tight hamstrings. Kids need to have hamstrings that aren't tight for a lot of activities, but certainly for walking. And so we work on long leg sitting with the weight on her feet just to help stabilize her when she's sitting. And we work on getting her to sit up straight. The bouncing and catching the ball is just an activity that makes it fun to sit there. I think for me the biggest difference with the treadmill is that I can have a child walk at a pace consistently for a while, whereas when I have them walking on the floor, it's difficult to keep them moving. They'll stop and they'll want to stay there for a while, and with the treadmill I can say, okay, we're going to walk for a minute or 2 minutes, or we'll walk as long as we can and then we'll stop. and you can just keep a pace up and really get a lot more work out of them. And the other big advantage with the treadmill is you can get your hands on them and facilitate movement in an easier way than trying to follow them around the room. So, do you see carryover as far as improved gait pattern after using the treadmill with this child? Yes, I do. I think that especially as far as taking independent steps, she's more willing to take bigger steps after working on the treadmill for several minutes. And then I'll get her down on the floor and have her take some steps. And she just is more comfortable with that movement and is able to take better steps also. Slower steps and better steps.